knee pain relief without surgery. I want to give you some simple steps to reduce pain and stay active. Why do you have knee pain and why does it persist? Knee pain can be one of those most difficult conditions because you use your knees a lot. I think back to when I was a teenager and I was playing a lot of sports, like I was playing hockey, and my knees were really hurting. And just as they started to get better, I'd play another game or go to a practice, and my knees would hurt again. And this kept happening. So my father took me to a chiropractor. He examined my knees, took x-rays, diagnosed the condition properly, and recommended care. And that totally made a difference for me. And that's when I decided I wanted to become a chiropractor. I was like 14 at the time. And here I am over 30 years later in practice. And I went through all this schooling, and I've seen a lot of knee conditions in the clinic here, as well as different types of conditions. Often, the focus in clinics is on the pain and treating the pain, like, let's say, painkillers, anti-inflammatories, that type of approach. But really what has to happen is you have to find the cause of the problem to correct it. The pain is the body's signal telling you that there's a problem there, but you have to dig deep and find out what's causing that pain. Rest, injections, and braces often delay recovery. For example, if you're resting it, the muscles are going to get weak and there's going to be some atrophy. And then you go to use your knee and it's weaker and it's re-injured again. So I prefer, if possible, to do treatments in conjunction with things like ice and stretching and rest, because we want to be active in moving the knee from being injured to being healthy again. And it's the more active the patient is and the more active I am, the shorter the time to recover. Over-reliance on imaging. Imaging's good, like x-rays, MRI, CT scan, but it's not the whole story. So sometimes, you'll see cartilage damage on a CT scan or MRI, and yet the person doesn't have much pain. That's same type of x-ray or MRI, same type of damage, and a different person, they can have a lot of pain. So it's not just the structure, but it's the way the joint's functioning. It's the condition around the joint, the inflammation. It's what the person does and their history. There's just so many aspects to it. And that's why assessing the joint properly is very important. Weak links above and below the knee are ignored, and they can stress the knee. So, for example, if your hips are out of alignment, it can put more pressure on the knee joint on one side versus the other. If your ankle is not working properly in your foot, you can be compensating by putting too much strain on the knee. So we want to look at not just the knee joint, but the joint above and below, and just get everything lined up and functioning properly. We call that proper gait, or the plumb line, to make sure the forces are being distributed equally in the body. It's usually not just the knee. So like I said, hip mobility, glute strength is important, foot mechanics and ankle stiffness, core control and load transfer. Sometimes people have jobs where they're leaning too far forward on their feet or too far backward. Poor movement patterns over time. So poor gait, the way you walk. Sometimes you can look at the bottom of the shoe, you can actually see one area wearing out faster than the other. Or if we take an x-ray, let's say, of the knee, we're going to see the knee wearing out on one side faster than the other, and that's called arthritis, and I'm going to talk to you about that today. The 4 drivers of knee pain: muscular imbalances. Let's say the quad's dominant, it's strong, but the glutes are weak. Poor load management, too much or too little in a certain area. Joint restriction in the hip, ankle, and the spine can cause misalignments in the knee and stress on the knee, and repetitive strain and poor recovery, just not dealing with the condition properly. So what works and why? Well, correct movement before strengthening. So we want to get the foundation corrected, the structure, the alignment of the bones. We want to improve the joint motion, the function of the joint, before adding a load to the joint. We want to reduce inflammation without full rest. So we want to make sure the inflammation's coming down, get the swelling down so the person feels better, but also be able to use their joint. And then train the knee to tolerate doing their activities again. If they're a postal carrier, we want to make sure they can walk properly and they can do their job. So it's important that we take that approach. Now, here's some different conditions that we see in the clinic. One of them is a knee sprain. I just had a teenager, she twisted her knee snowboarding for the first time. And that twist caused a lot of pain in the front part of her knee and the side. So we assessed the knee, we checked the function of the knee, we looked for the imbalances in the knee. Then I started doing chiropractic adjustments to the knee, which actually didn't hurt her at all. I did the adjustments. She felt good after the adjustment. Then what I did was some shockwave and laser to help promote the healing of the tissue, some orthotics to help rebalance the foot and to change the mechanics in the knee, and then some coaching. The coaching was to give her advice on stretches and exercises she should be doing, as well as some lifestyle changes, like when she goes back to skiing again, some tips on proper mechanics when she's skiing. In the meantime, if you do have a knee sprain, a product like BioFreeze, which we carry here in the clinic, can be very helpful because it's more of a natural product than a pharmaceutical. It's very fast acting for relief, and it reduces joint discomfort. Patellar tendonitis, when the kneecap doesn't track properly over the knee joint. There's a groove in the front part of the knee, and when the kneecap, which is called the patella, is not gliding through the knee groove properly, it can start to cause friction. It can rub on one side or the other, causes inflammation, and then you can start to feel pain. Often when people have patellar tendonitis, they'll be stretching their knee out. You'll see them maybe on a plane where their legs out in the aisle. They're sitting in a car and they have to extend their leg far out because having the knee bent causes too much discomfort in the knee. So what do we do for that? We want to assess the knee and the kneecap. We want to do adjustments to realign the kneecap and the knee joint. We want to do shockwave to break down scar tissue in the knee. We want to do laser to heal the soft tissues once the scar tissue is broken down. And then orthotics are good to realign the foot and the way the person walks. And then some stretches and exercises through health coaching, nutritional tips to help the patient to rehabilitate the knee. One product I like to recommend for this is our ice packs. Our ice packs can really help reduce swelling, especially at the beginning when there's quite a bit of discomfort there due to the inflammation. These ice packs we have can be used as heat, and often I tell people to use ice for the first week or two. And once the pain starts to reduce, I'll tell them to switch from ice to heat, and that tends to help accelerate the healing process. It softens the tissue, makes it a little easier for us to do our treatments. Arthritis. This is another common condition we see, and this is when the knee is wearing out unevenly. The forces on the knee are uneven. It's kind of like a car that's out of alignment. The tires are going to wear out on one side faster than the other. So what can be done? Well, chiropractic care to realign the joint, that's easy. Shockwave and laser, that's going to help heal the tissues around the knee, including in the joint. Orthotics to rebalance the force on the knee from the ground up. And then health coaching. The health coaching comes in the form of nutritional advice like this product we'll talk about in a sec. And also you can do things like collagen is good. Increase your protein intake, which can really help with the rehabilitation of the knee joint, and some anti-inflammatories. Some natural ones are better. So I like to give this product this glucosamine and chondroitin. Glucosamine and chondroitin have been around for 30, 40 years. And it was actually an orthopedic surgeon that developed this product. I think he was down in the Florida area in the US. And once the research was done on it, it showed that it really supports the joint cartilage. It aids in inflammation management as well. All right, knees. Why are they so important? Well, you're weight bearing and using them so much compared to a joint like the elbow, which would be the cousin to the knee, same type of joint. You're using your knees much more. So sitting, doing stairs, having the proper footwear, your walking habits, all very important. You need to warm up a bit, especially if you're doing things like lifting and twisting. Give the knees a chance to warm up, to get lubricated and to start to circulate the synovial fluid, that fluid that nourishes the knee joint right inside that capsule in the knee. Small changes compound over weeks. So as you start good habits, it's going to lead to some positive changes long term. And consistency beats intensity, meaning at the beginning, even if you're not doing the stretches and exercises we give you to the full capacity, just getting in the habit of doing them is a good start. This is a good example. I went to a new gym. I just joined a new gym. The equipment's a little bit different than the gym I'm used to. So today I was finding the equipment, doing reps on it, but at less weight than I normally do, just to get a hang for the mechanics. And it was a good thing I did, because I was doing squats. And when I was doing these squats, the machine was different, like the handles and the way you lock the machine. So if I had a lot of weight on there, it would have been, I didn't know how to lock it. That would have been not good. So I had no weight on there. I was just checking how the machine worked, and I was able to pull up on the handles and lock the machine and then put some weights on it. Smarter training for knee health. So you want to do safe versus risky exercises. So the context matters. And that's why it's important to have a health professional that knows your knee condition giving you good advice. Squats, lunges, and step-ups are really good for the knee if they're done correctly. No pain, no gain can backfire. If you're starting to feel pain, you should back off, especially if it's sharp pain, and then talk to your healthcare professional about it. You want to have some rules or progression rules to prevent flare-ups. So some things you can do to mitigate the risks of a flare-up. So the number of reps you're doing, the weight you're doing, the type of exercise you're doing, all very important. That's why it's good for us to know your knee condition and what to do. A simple plan you can start this week. So start to focus on priorities. If you haven't had your knee checked yet, go to a chiropractor in your area, have them check your knee. If you're in Kelowna, come and see us. We are accepting new patients. You don't have to have a doctor referral. We bill directly to insurance, and often we do have same and next day appointments. The doctor should talk to you about how to progress safely with your knee condition. Red flags versus normal discomfort. What is normal? I had a patient today having some spasms in his back, and he was bent to the side, and we were talking about, he was doing some stretches. We were talking about what good stretching is versus bad stretching and what the symptoms mean. So, you want to be aware of normal discomfort versus sharp pain, or maybe you're re-injuring yourself. And then when to get help and what to ask for. Now, if you're interested in following up in our clinic, you can scan these QR codes. The first one's for an initial consultation. So you can scan this code and then book an appointment here in our clinic. If you just want to talk about your condition, we do offer a free consult. So we can set up a Google Meet or a Zoom call and then talk to you online about your condition. If you want to know more about what you can do for your specific condition, you can join our mastermind classes. This is 4 consecutive weeks of classes to help you understand your knee condition, what stretches you should do, what supplements you should take. So you'll join us. There'll be other people there, and it's a once a week mastermind class. And when you go to sign up for that, you pay one fee for the entire 4 weeks or 1 month package. And then we do have the knee pain book. We just uploaded that to Amazon. It's live now in paperback. The ebook should be live in a day or two. The audiobook will probably take us another week, but depending on when you're watching this, you'll be able to get a copy of that book, at least in the paperback format right now. The audiobook does take a little longer because they have to approve the audio tracks, and then it goes live. So I want to thank you for joining us today. In the chat, I'm going to put in the links for these QR codes. So if you can't scan this with your phone right now, then I'll put those links there. All you have to do is click on those links. It'll take you right over to the service that you're looking for, including booking a new appointment in our clinic.